Part B. In this part of the test, you'll hear different extracts. You'll have time to read each question before you listen. Now look at question 1. You hear a pharmacist talking to a patient called Mihiraa. Now read the question.
Mihiraa, it's crucial to shake your inhaler vigorously before each use. This ensures that the medication inside is evenly distributed. Hold the inhaler upright and inhale slowly and deeply as you press the top. Once the medication is inhaled, hold your breath for about 10 seconds to allow it to reach deep into your lungs. If you require another puff, wait at least a minute before repeating the process. Regular cleaning of the mouthpiece is essential to maintain optimal inhaler function.
So, to summarize, I should shake the inhaler well to mix the medicine, inhale slowly while pressing, hold my breath, and wait a bit before using it again. Got it?
Exactly. Shaking is vital to ensure you receive a consistent dose with each inhalation. If you find yourself needing frequent refills or experiencing difficulty breathing, it might be time to consider using a spacer. This device can help improve medication delivery. Also, if you notice rapid breathing after using your inhaler, it's essential to inform your doctor. Exactly. Shaking is vital to ensure you receive a consistent dose with each inhalation. If you find yourself needing frequent refills or experiencing difficulty breathing, it might be time to consider using a spacer. This device can help improve medication delivery. Also, if you notice rapid breathing after using your inhaler, it's essential to inform your doctor.
Now look at question 2. You hear a physician talking to a patient called Mihiraa. Now read the question. Mihiraa, you've sprained your ankle. We need to reduce swelling first. Elevate your foot above your heart as much as possible. Ice it for 20 minutes every hour. Avoid putting weight on it for a few days. Compression bandages can help, but ensure they're not too tight. Over-the-counter pain relievers like ibuprofen can assist with discomfort.
So, I should keep my foot up, ice it often, not walk on it, use a tight bandage, and take those pain pills?
Exactly. But remember, the bandage shouldn't cut off circulation. If your foot turns blue or feels numb, loosen it. Also, if the swelling increases, pain worsens, or you can't bear any weight after a week, return for a checkup.
Now look at question 3. You hear a nursing manager talking in a morning meeting. Now read the question.
Good morning, team. I'm excited to announce the implementation of a new pre-procedure checklist. This is a critical step towards enhancing patient safety and standardizing our practices. The checklist covers everything from patient identification and consent to equipment readiness and emergency protocols. It's essential that every member of the team adheres to this checklist rigorously. We've incorporated input from all departments to ensure it's comprehensive and practical. Remember, this isn't just a piece of paper. It's a safeguard for our patients. It's designed to reduce the risk of errors, improve communication, and ultimately, enhance patient outcomes. I understand there might be an adjustment period, but I trust your professionalism to embrace this change. Let's make this checklist a cornerstone of our patient care. Any questions?
Now look at question 4. You hear 2 nurses talking in a ward. Now read the question. Mihiraa, have you seen the chart in room 321? The patient, Mr. Porter, is post-op from a hip replacement. His vitals are stable, but he's been complaining of pain in his calf. I've already elevated the leg and applied a warm compress, but the swelling seems to be increasing. I'm worried about a potential DVT.
Deep vein thrombosis? Calf pain, swelling, and redness are classic signs. We need to notify the doctor immediately. Let's check for any other symptoms like shortness of breath or chest pain. Also, we should continue to elevate the leg and apply compression stockings.
Good thinking, Mihiraa. I've already started documenting everything. We should also prepare for a possible Doppler ultrasound to confirm the DVT. In the meantime, let's keep a close eye on his oxygen saturation levels and heart rate.
Absolutely. I'll update the patient's family about the situation and let them know what to expect. We need to be prepared for potential interventions, like anticoagulant therapy.
Now look at question 5. You hear a doctor talking to a junior nurse. Now read the question.
Mihiraa, we're using dissolvable stitches on Mrs. Lee's abdominal incision. They're made of a special material that the body absorbs over time. This means no need for removal, which is less painful for the patient. However, they don't provide as much strength as traditional stitches initially. So we need extra protection with the glue. It's crucial to monitor the wound closely for signs of infection, like redness, swelling, or increased pain. Also, avoid strenuous activities until the stitches have fully dissolved.
So, dissolvable stitches are like magic, they just disappear? But they're not as strong, that's why we've reinforced them with surgical glue. Got it. I'll keep an eye on the wound and let you know if anything changes.
Exactly. They're a great option for certain types of wounds, but understanding their limitations is key. Remember, patient education is essential. Make sure Mrs. Lee knows about the dissolvable stitches and what to expect.
Now look at question 6. You hear a dentist talking to a patient. Now read the question. Mihiraa, flossing is as important as brushing. It removes plaque and food particles from between your teeth that your brush can't reach. This helps prevent cavities and gum disease. You should floss at least once a day, preferably before brushing. Use about 18 inches of floss, wrap it around your middle fingers, and gently slide it between your teeth. Go up and down the sides of each tooth.
So, flossing gets the stuff my toothbrush misses. That makes sense. But won't it hurt my gums if I do it wrong?
It might if you're too rough. Be gentle at first. If your gums bleed, don't stop flossing, but be more careful. Regular flossing will actually help your gums become healthier over time. It's like exercising for your mouth. Now look at question 7. You hear a nurse called Mihiraa talking to a nursing manager. Now read the question.
Ms. Georgina, I've noticed a recurring pattern of extended breaks among the night shift staff. It's impacting patient care. For instance, during the last shift, Nurse Patel was absent for nearly 30 minutes, leaving patients unattended. Additionally, there's been a rise in medication errors, which I suspect might be linked to fatigue caused by these prolonged breaks.
Mihiraa, this is a serious concern. Extended breaks are unacceptable, especially on night shifts. Medication errors are a major red flag. We need to address this promptly. I'll schedule a mandatory staff meeting to discuss break policies and their implications. It's crucial to emphasize the importance of patient safety and accountability. We'll also implement stricter break schedules and random checks. Mihiraa, I want to assure you that we're taking this matter very seriously. Now look at question 8. You hear a physician talking to a nurse called Mihiraa. Now read the question.
Mihiraa, I need you to adjust the dosage for Mr. Dillon in room 303. The new medication, carvedilol, seems to be interacting with his existing diuretic, leading to hypotension. Let's reduce the carvedilol by 25% for now. Monitor his blood pressure closely over the next 24 hours. If it drops below 90/60th systolic, we might need to discontinue it altogether. Also, keep an eye on his potassium levels. Diuretics can sometimes deplete potassium, which can exacerbate the hypotension. If his potassium falls below 3.5, Mihiraa will need to supplement it.
Understood, Dr. Peter. I'll adjust the medication order immediately and inform the pharmacy. I'll also initiate blood pressure monitoring and potassium level checks. I'll keep you updated on any changes.
Now look at question 9. You hear a nursing manager called Mihiraa talking in a morning meeting. Now read the question.
Good morning, team. I have an important announcement. To enhance patient safety and accountability, we're implementing a biometric system for entry and exit from the ward. This means you'll be required to scan your fingerprint to clock in and out of your shift. I understand there might be concerns about privacy and convenience, but this system is essential for maintaining accurate staffing records, improving patient care, and ensuring compliance with regulatory standards. We've chosen a highly secure system that protects your biometric data. There will be a mandatory training session next week to familiarize everyone with the new system. If you have any questions or concerns, please feel free to approach me or the HR department. Now look at question 10. You hear two nurses talking in a ward. Now read the question.
Did you hear about the new admission, Mihiraa? They brought her in with severe pneumonia. She's in room 302. Apparently, she's an elderly patient with a history of heart problems. They're concerned about her oxygen levels dropping, so we need to monitor her closely. Also, she's on a bunch of medications, including diuretics, which can mess with her potassium levels. Mihiraa, we need to watch out for signs of hypokalemia.
Pneumonia and heart problems, that's a tough combo. We'll have to be extra vigilant. I'll check on her oxygen levels every hour and make sure she's comfortable. Let's also double-check her medication administration times to avoid any conflicts. We should probably get a blood test to check her potassium levels as well. Poor thing, hope she recovers quickly.
Now look at question 11. You hear a doctor talking to a junior doctor called Mihiraa. Now read the question.
Mihiraa, we need to be more selective about our wound dressings. Alginate dressings are great for absorbing exudate, but they can be expensive and difficult to remove. Hydrocolloids are good for autolytic debridement, but they can't handle heavy exudate. For those patients, consider hydrogels or foam dressings. Remember, the key is to choose a dressing that matches the wound's specific needs. For instance, if there's a risk of infection, silver dressings might be beneficial. Also, don't forget about the patient's comfort. Hydrocolloids can be quite adherent, which can be painful to remove. Mihiraa, got it, Dr. Paul. I'll make sure to assess each wound carefully before choosing a dressing. I'll also keep the patient's comfort in mind. Thanks for the guidance.
Now look at question 12. You hear a nurse talking to a patient called Mihiraa. Now read the question.
Hi Mihiraa, I wanted to talk to you about your medication. The doctor has decided to switch you from the liquid form of your medicine to a tablet. It's the same medication, just a different form. The tablets are easier to swallow and might have fewer side effects. We'll start you on a lower dose of the tablet and gradually increase it to match your current dose. It's important to finish the liquid medication before you start the tablets to avoid any gaps in your treatment. Also, remember to take the tablets with food to help with absorption. Do you have any questions?
So, I'll finish the liquid stuff first, then start the tablets. And it's okay if I eat something with them?
That's right, Mihiraa. We want to make this transition as smooth as possible for you. Please let me know if you experience any side effects or if you have any trouble swallowing the tablets.
Now look at question 13. You hear a pharmacist called Mihiraa talking to a nursing manager. Now read the question.
Mihiraa, the anti-dandruff shampoo you're looking for is ketoconazole based. It's potent, but it can be drying. We recommend alternating it with a gentler, moisturizing shampoo like the one containing pyrithione zinc. Remember, consistency is key. Use it twice a week for a month, then reduce to once a week for maintenance. While it's effective, it might take a few weeks to see significant improvement. Also, avoid hot water as it can irritate your scalp.
So, I should use the ketoconazole shampoo every other day for a month, then just once a week? And I should use a different shampoo on the other days?
That's right. The pyrithione zinc one will help balance your scalp. Now, ketoconazole can sometimes cause a slight initial increase in dandruff before it clears up. Don't be alarmed if that happens. It's a temporary reaction. Also, while rare, some people experience mild itching or redness. If it gets worse or doesn't improve, let us know.
Okay, got it. So, I should watch out for itching, too.
Exactly.
Now look at question 13. You hear a surgeon talking to a nurse called Mihiraa. Now read the question.
Mihiraa, we're scheduling the laparoscopic cholecystectomy for Mrs. Paul tomorrow. Given her history of adhesions from a previous surgery, we'll need to be extra cautious. I want you to double-check the CO2 insufflation settings. We'll be using the harmonic scalpel for dissection, but have the electrocautery ready as a backup.
Got it. I'll verify the insufflation settings and prepare both the harmonic scalpel and the electrocautery. Should we anticipate any specific challenges due to the adhesions?
Absolutely. Adhesions can distort the anatomy, making identification of structures more difficult. We might encounter increased bleeding, so be prepared with additional suction and cautery. Also, ensure we have adequate lighting. The Zeus camera is preferred, but if there's an issue, we'll switch to the HD camera.
Understood. I'll confirm the equipment and lighting. Should we anticipate any specific postoperative complications given the adhesions and the laparoscopic approach?
While laparoscopy generally results in less postoperative pain, adhesions can increase the risk of wound infections. So, emphasize meticulous wound care in the post-op instructions. Also, monitor her for signs of bowel obstruction closely, as adhesions can contribute to that.
Now look at question 27. You hear a nurse talking to a junior nurse called Mihiraa. Now read the question.
Mihiraa, pagers might seem old school, but they're still crucial in this environment. Sure, they're one-way communication, but their reliability is unmatched. You'll get paged for everything from lab results to urgent patient needs.
I understand, but what about privacy? Anyone can see the number on the pager.
That's a valid concern. We have a code system to address that. Numbers correspond to specific situations. For instance, 101 is a general call, while 203 might indicate a code blue. It's essential to memorize these codes. Also, always prioritize urgent pages, like those starting with 2.
Got it. So, I should always carry the pager, even during breaks?
Ideally, yes. Emergencies can happen anytime, but if you absolutely must step away, inform the charge nurse. They can redirect urgent pages to someone else. Remember, a missed page could have serious consequences. Now look at question 16. You hear a diabetologist talking to a patient called Mihiraa. Now read the question.
Mihiraa, gestational diabetes is a temporary condition that develops during pregnancy. It's crucial to manage it closely for both you and the baby's health. While diet and exercise are often sufficient, we might need to introduce insulin if blood sugar levels don't stabilize.
I'm a bit worried about insulin. Will it harm the baby?
Absolutely not. Insulin is a natural hormone. In this case, it helps your body use glucose effectively. It's a tool, not a treatment. Regular monitoring, a balanced diet rich in fiber, and moderate exercise are still essential.
Okay, I understand. But what about weight gain? I've heard conflicting advice about how much weight is safe to put on during pregnancy.
It's individual, but generally, gradual and steady weight gain is recommended. Focus on nutrient-dense foods. Avoid excessive sugary drinks and refined carbohydrates. Your midwife or dietitian can provide more tailored guidance. Remember, it's not just about the number on the scale but about overall health.
Now look at question 17. You hear a GP talking to a nurse called Mihiraa. Now read the question. Mihiraa, I'm concerned about Mr. Peters. His blood pressure readings have been consistently high, despite medication adjustments. We need to schedule a follow-up in 2 weeks to reassess his condition. Also, I've noticed some unexplained weight loss. I want you to schedule blood tests to check for any underlying issues.
Got it, Dr. Link. I'll schedule the follow-up and blood tests. Should we refer him to a specialist if the blood pressure doesn't improve?
Let's see how the next appointment goes. If there's no significant improvement, we might consider a nephrologist. But for now, let's focus on optimizing his current medication. Also, emphasize the importance of lifestyle changes, diet, exercise, and stress management.
Will do. And about his medication, should we explore alternative options if he experiences side effects?
Absolutely. We can adjust the dosage or try a different class of medication if needed. But let's prioritize compliance with the current regimen first. It's crucial for controlling his blood pressure.
Now look at question 18. You hear a nursing manager talking to a nurse called Mihiraa. Now read the question.
Mihiraa, I need you to keep a close eye on Mrs. Soni in room 302. She's post-op from a hip replacement and is showing signs of early delirium. We need to prevent her from trying to get out of bed, as that could dislodge the hip implant.
Understood, Linda. I'll increase her observation and make sure the bed alarms are on. Should I start her on anti-delirium medications?
Not yet. Let's try non-pharmacological interventions first. Ensure she's well hydrated, oriented to her surroundings, and has adequate pain control. We can reassess in a few hours. Also, involve her family in her care as much as possible.
Okay. I'll make sure to keep the family informed and involved. Anything else I should be aware of?
Yes, her oxygen saturation levels have been fluctuating. Keep a close watch on that. If it drops below 92%, notify me immediately. We might need to increase her oxygen flow.
Now look at question 19. You hear a pharmacist talking to a patient called Mihiraa. Now read the question. Mihiraa, choosing the right sunscreen can be overwhelming. Let's break it down. The most crucial factor is the SPF, or sun protection factor. This number indicates how long the sunscreen protects you from UVB rays, which cause sunburn. However, remember, no sunscreen offers complete protection.
So, a higher SPF is always better, right?
Not necessarily. While a higher SPF might sound more appealing, the difference in protection between SPF 30 and SPF 50 is minimal. It's more important to reapply sunscreen every 2 hours, especially after swimming or sweating.
I see. What about UVA rays? Don't they cause skin damage too?
Absolutely. UVA rays penetrate deeper into the skin and contribute to premature aging and wrinkles. Look for broad-spectrum sunscreen, which protects against both UVA and UVB rays. Additionally, consider wearing protective clothing and seeking shade during peak sun hours.
Now look at question 20. You hear a nursing manager talking to a nurse called Mihiraa. Now read the question.
Mihiraa, we need to closely monitor patient 452, Mr. Paul. He's at high risk for seizures due to his recent brain surgery. His sodium levels are slightly low, and he's been experiencing some fluctuations in blood pressure, both of which can trigger seizures.
I understand, Nino. I've already implemented seizure precautions. I've raised the bed rails, patted the side rails, and made sure suction equipment is readily available.
Good, but we need to be proactive. Educate his family about seizure first aid and the importance of calling for help immediately. Also, keep a close eye on his oxygen saturation levels. Sudden drops can precede a seizure. And Mihiraa, administer anti-seizure medication as ordered, but be prepared to assist with intubation if necessary.
I'll make sure the respiratory therapist is aware of the situation. We'll be ready for any eventuality.
Excellent. Remember, early intervention is crucial. Any signs of seizure activity, no matter how subtle, should be reported immediately.
Now look at question 21. You hear a nurse talking to a junior nurse called Mihiraa. Now read the question.
Mihiraa, I want to emphasize the importance of proper fore infusion. It's a delicate procedure with potential complications. Always verify the doctor's order, patient identity, and medication before starting.
Of course, Mario. I double-check everything.
Good. But it's not just about the initial setup. Monitor the infusion site closely for signs of infiltration or phlebitis. If the site looks red, swollen, or painful, stop the infusion immediately. Also, watch for fluid overload. Mihiraa, if the patient complains of shortness of breath, increased heart rate, or edema, slow down or stop the infusion and notify the doctor.
I'll keep an eye on those symptoms.
And remember, medication incompatibilities can be dangerous. Always check the drug handbook before mixing medications in the same bag. Incompatibility can lead to precipitation or inactivation of the drugs.
Now look at question 22. You hear a nurse talking to a doctor called Mihiraa. Now read the question.
Dr. Mihiraa, I'm calling about patient 321, Mr. Peter. He had a fall last night. He slipped and fell while trying to get to the bathroom. He complained of pain in his right hip.
How is he doing now? Any signs of head injury?
He's conscious and alert, but complaining of increasing pain in his hip. I've already applied ice packs and elevated the leg. No visible signs of head injury, but I've monitored him closely. Vital signs are stable. The indication of increased risk of infection due to the injury is nil.
Good. Order an X-ray of the hip immediately. I suspect a possible fracture. Meanwhile, administer pain medication as needed. We'll assess the need for further imaging once we have the X-ray results.
Will do, Dr. Mihiraa. I'll also assess his mobility and see if he needs assistance with daily activities.
That's important. Falls can lead to decreased mobility and increased risk of another fall. Implement fall prevention measures like bed alarms and non-slip socks. Now look at question 23. You hear a nursing manager Mihiraa talking to nurses during a meeting. Now read the question. Nurses, I have some important updates regarding new hospital policies. First, we're implementing stricter hand hygiene guidelines. All staff, including visitors, must use alcohol-based hand rub upon entering and exiting patient rooms. This is to reduce the spread of infections.
Will this increase our workload, Mihiraa?
Initially, yes, but it's crucial for patient safety. We'll provide additional hand sanitizer dispensers for convenience. Second, we're revising our documentation procedures. All patient assessments and interventions must be documented electronically within 15 minutes of completion. This will improve efficiency and accuracy.
What about nurses who work in high-stress areas? Mihiraa, will there be flexibility?
We understand the challenges. However, timely documentation is non-negotiable. We're exploring options like voice-to-text technology to streamline the process. Lastly, we're introducing mandatory annual training on patient safety and fall prevention. This includes education on proper patient positioning, use of assistive devices, and early identification of fall risks.
Now look at question 24. You hear a nursing manager called Mihiraa talking to nurses. Now read the question.
Good morning, team. I want to address the patient fall incident that occurred yesterday in Ward B. Mr. Peter, room 302, unfortunately, slipped and fell while attempting to use the restroom. He sustained minor injuries, but this incident highlights the importance of patient safety.
Was it due to understaffing? We've been short-handed lately, Mihiraa.
Staffing levels are a concern, but the primary factor seems to be a missed opportunity for intervention. Mr. Peter's call bell was not answered promptly. This emphasizes the need for timely response to patient calls. We need to improve our response times.
Mihiraa, should we consider using bed alarms for all patients?
Bed alarms are one tool, but they're not foolproof. Regular patient assessment and proactive fall prevention measures are essential. We'll review each patient's fall risk and implement appropriate interventions.
Now look at question 25. You hear a nurse talking to a patient called Mihiraa. Now read the question.
Good morning, Mihiraa. How are you feeling today? Ready for your flu shot?
A bit nervous, actually. I've heard the flu shot can cause a lot of side effects.
It's understandable to feel that way. The most common side effects are soreness at the injection site, mild fever, and muscle aches. These usually go away within a day or two.
Okay, that doesn't sound too bad. I'm more concerned about getting the flu. I have asthma, so I'm worried about complications.
Getting the flu shot is especially important for people with chronic conditions like asthma. It helps protect you from getting sick and reduces the severity of symptoms if you do catch the flu.
I see. Can I take any medication to prevent the side effects?
Yes, Mihiraa. Over-the-counter pain relievers like ibuprofen can help with soreness and fever. However, it's best to consult with your doctor before taking any new medication.
Now look at question 26. You hear a doctor talking to a patient's wife called Mihiraa. Now read the question.
Mrs. Mihiraa, your husband Mr. Paul, has sustained a mild concussion. It's important to monitor him closely for any worsening symptoms.
I'm so worried, doctor. What kind of symptoms should I look out for?
Initially, he might experience headaches, dizziness, nausea, or vomiting. He may also feel confused or have difficulty concentrating. It's essential to avoid strenuous activities, driving, or consuming alcohol until he's fully recovered.
How long will it take for him to recover?
Mihiraa, recovery time varies from person to person. It could take a few days to a couple of weeks. We'll schedule a follow-up appointment to assess his progress. In the meantime, ensure he gets plenty of rest, maintains a balanced diet, and avoids exposure to bright lights and loud noises.
Will he have any long-term effects from this?
Most people recover fully from a mild concussion. However, in some cases, symptoms can persist. We'll monitor his condition closely and provide appropriate treatment if needed. Now look at question 27. You hear a doctor talking to a practice nurse called Mihiraa. Now read the question. Mihiraa, have you finished the weekly report yet? We need to finalize it before the end of the day.
Almost done, Dr. Martin. I've completed the patient consultations and immunization data. I'm just double-checking the chronic disease management figures.
Great. Have you included the referral data for this week? We need to ensure we're meeting the targets for specialist appointments.
Yes, it's included. There seems to be an increase in referrals for respiratory issues. We might need to schedule extra clinics next month.
Good catch, Mihiraa. Let's discuss that during the practice meeting. Also, have you checked the medication reviews? We want to ensure patients are taking their medication correctly and there are no interactions.
Yes, I've completed the medication reviews. There are a few patients who need follow-up appointments. I've flagged them for your attention.
Excellent. Once you've finished, please send it to me for final review. We need to identify any potential issues early on.
Now look at question 28. You hear a nurse talking to a nursing manager called Mihiraa. Now read the question.
Harry, I'm having issues with the quality of the gloves we're using on the ward. They've been tearing easily, and it's becoming a real problem during patient care.
That's concerning, Mihiraa. Patient safety is our top priority. We can't have nurses risking exposure due to faulty equipment. Have you reported this to the supply chain department?
I did, but they said there's a shortage of medical supplies and this is the best they can offer for now.
That's unacceptable. We need to find a solution quickly. I'll contact the hospital management about this. In the meantime, can you document every incident of glove failure? We need data to support our case.
Definitely. I've already started keeping a log. I'm also worried about the impact on patient satisfaction. They can see we're struggling.
Mihiraa, it's crucial to maintain a positive patient experience. We'll address this issue promptly. In the meantime, let's explore alternative options, like double gloving or using different types of gloves for specific procedures.
Now look at question 29. You hear a physiotherapist talking to a GP called Mihiraa. Now read the question.
Mihiraa, I'm concerned about Mr. Peter's progress. His physiotherapy sessions aren't showing the expected improvement in his knee mobility.
That's interesting. Has there been any increase in pain or swelling?
Not really. The pain seems to be manageable. It's more about a stiffness that's limiting his range of motion. I've tried different techniques, but there's minimal progress.
Have you considered any underlying conditions that might be affecting his recovery? Perhaps we should order some blood tests to rule out any inflammatory issues.
That's a good point. I'll discuss it with Mr. Peter and see if there's anything else he's been experiencing. Maybe there's a psychological component affecting his recovery.
Absolutely. Sometimes, pain can be influenced by emotional factors. Let's refer him to the pain management clinic for a comprehensive evaluation.
That sounds like a good plan, Mihiraa. We need to address this holistically. I'll schedule the referral and keep you updated on his progress.
Now look at question 30. You hear a nurse talking to a patient called Mihiraa. Now read the question.
Good morning, Mihiraa. How are you feeling today? Are you comfortable using the wheelchair?
It's okay, but I'm finding it a bit difficult to maneuver in tight spaces.
That's understandable. It takes some time to get used to. We can practice navigating different areas together. Remember, it's essential to lock the wheels whenever you stop to prevent accidents.
I'm worried about losing my independence. I used to be so active.
It's natural to feel that way, but using a wheelchair doesn't mean you're completely dependent. We can work on strengthening your upper body to make transfers easier. There are also adaptive equipment options to explore, like reachers and dressing aids.
I'm concerned about pressure sores. How can I prevent them?
Regular skin checks are crucial, Mihiraa. Shifting your position every 2 hours, using pressure-relieving cushions, and maintaining good hygiene can help. We can also teach you some exercises to improve blood circulation.